What does a $13.5 million malpractice lawsuit in the state of Idaho and Bruce Willis's dementia have in common? Well, it's more than just the fact that they're topics on today's episode of The Prescription Press, the podcast for people who want to stay on top of the medical news so they can live longer and healthier lives. I'm your host, Nolan Fisher. I'm a physician, and I'm going to be here with you breaking down topics into info that we can use. Let's dive into the stories.
1, 2, 3, come on!
All right, so because this first story was about a patient that had a stroke, I want to do a little background info so that we can understand it better. So here's a picture that I'm sharing, if you're watching on video, of different arteries that go to the head. The first thing you need to know about a stroke is that it's irreversible brain damage that occurs because of disruption to the blood supply in these arteries to a certain part of the brain. There's multiple reasons that this can happen. Usually it's because something gets stuck in an artery, or it can also happen because one of these arteries bleeds. So, when you see somebody with the traditional symptoms of a stroke, which people are pretty accustomed to, that's the facial droop, the upper extremity weakness, and slurred speech or difficulty talking, that happens because something happens with the common carotid artery or some of the arteries that come after the common carotid. This is the major blood vessel when it's leaving the heart, whenever the blood vessel is leaving the heart and going to your brain. And because it's a big one and it leaves the heart early, it's affected commonly. A good example would be for people who have irregular heart rhythms. They will develop clots that float around in their heart and eventually they get kicked out, and this artery is a big exit ramp for those clots to go up to the brain. Now, those strokes are common. They're screened for whenever people come to the hospital with any sort of symptoms that could be similar or confused for strokes, and so usually they're not missed. However, this vertebral artery over here on the right is further down and less common. It can get strokes in similar ways, but it can also rupture and bleed and cause strokes as well. Those strokes tend to be different. They tend to be called brainstem strokes, and they aren't as easy to catch. They cause things like dizziness. They cause things like difficulty swallowing. They cause things like headache and ears ringing and all sorts of random, nondescript symptoms, like symptoms that aren't only associated with a stroke. And so that's where this can get confusing, and it really takes an astute clinician to understand this. So I'm going to take down this picture of the arteries, and I'm actually going to show you the brainstem. And the brainstem is important to understand because that's where the vertebral artery goes to. So you can see here with this picture, if you're watching on video, there's the midbrain pons medulla. There's the vertebral arteries coming up to them, and then there's the basilar artery. That's where the vertebral arteries meet up. You can get hemorrhages and clots that happen around here. And this brainstem, it communicates with all of the brain, and it communicates with the spinal cord. So as a result, these symptoms tend to be less specific, more global. They can cause things like confusion, dizziness, difficulty with balance. And these symptoms, like I said, are way harder to catch. With that being said, and that background information, now let's dive into the first news story. Okay, the first news story is going to be the $13 million lawsuit. And I got it pulled up right here. So let's scroll up to the top and see what it has to say. ED doc and group owe $13.5 million after patient's serious brain injury. This is by Wayne J. Guglielmo. I don't know if that's pronounced correct, but God, I hope it is. So we have the second largest medical malpractice award in the state's history. This is of Idaho, of course. The incident took place in the early morning of March 29th, 2016. It says that an Ada County resident peered into the family's bathroom and discovered that her husband lay on the floor confused and vomiting and complaining of a severe headache. Recently, the man had experienced several of these same symptoms, plus sinus congestion, dizziness, and tinnitus. Tinnitus is simply just the ears ringing. Happens to most of us as we age. And I'm sure with all of us growing up listening to headphones, we're all going to get it. So, the first thing you think about when you hear somebody who is confused, vomiting, and complaining of a severe headache is a brain bleed. The thing that every medical student in the country is taught is that the worst headache of your life equals a brain bleed until proven otherwise. With that being said, the confounding picture here is the fact that there's sinus congestion, dizziness, and the ears are ringing. So that's more nonspecific, and who knows how well that's communicated whenever they get to the hospital. Of course, the wife does the right thing. When the husband's confusion gets worse, she calls for an ambulance, and they get to the hospital at 4:12 a.m. Within approximately 11 minutes, he was examined by a doctor and underwent a CT scan of the head. This is pretty quick. 11 minutes is not too bad, especially for 4:12 in the morning, and who knows how busy they are. It is 4:12 in the morning, so they're likely not at full staff like they are during the day. The second doctor said this CT scan showed no intracranial process. Basically, this is a radiologist who looks at the pictures and says there's no massive bleed in here. So for one of those, like a big brain hemorrhage or big trauma, this is what they're looking for, a huge bleed on the CT scan. Smaller bleeds, smaller strokes, really difficult to pick up on a CT scan, and they're often missed. So Stifel's condition improved somewhat, although his dizziness persisted, leaving him still unable to walk. At this point, the ED doctor admitted him and said that it was benign positional vertigo. But they did note that MRI would be a good idea if the patient does not improve in the next few hours. Anybody that gets admitted to the hospital, we don't want to get stuck on one diagnosis. We especially want to be certain to rule out the worst diagnosis. So for him saying a candidate for an MRI, that was him saying that, in the back of my mind, I think this still could potentially be a stroke. So that would be prudent to get one of those. The transfer from the ED to the main hospital reportedly took at least 3 hours. This sounds like a lot. It is way too common. We'll have people sit in the emergency room at hospitals I've worked at for way more than 3 hours. They'll sit down there for over a day sometimes. This happens for one particular reason, and that's that there's not beds available on the regular nursing floors or in the ICU for these patients to go to. This happens because the hospital is either full or it's understaffed, which have both been issues in the last couple of years. So, once admitted, he was observed by a healthcare provider, who they don't indicate who exactly it is, to be, quote, delirious without meaningful interaction. At least 4 hours would pass before the patient was seen by still another doctor. Who knows why it took 4 hours? I wonder if the nursing staff reported this to the physician that was on call. This is at night and early in the morning, so physicians are usually rounding on their ICU patients first. They're trying to find any discharges from the hospital and make sure everything's ready to go for them. So it's hard to tell exactly why it took 4 hours, but it's not uncommon to see people late morning or around lunchtime if you're exceedingly busy as a physician in the hospital. They contemplated MRI. Finally, they got an MRI at 5:50 p.m., almost 12 hours since he came to the ED. And this showed a torn artery in his neck and that he was experiencing a stroke. Clearly a very different diagnosis is what it says in the article. Again, this is why we have a differential diagnosis, and I'm sure this is why the emergency physician said that they need to consider getting an MRI. So they did a repair on the artery, but he, over the next 3 weeks, went to a rehab facility. That's where I work. Back to the hospital with bacterial meningitis. And ultimately, he was diagnosed with, quote, an irreparable brain injury, left disabled and unable to work. Naturally, the family was frustrated because of this delayed care, which could potentially have cost him some function in his life, because there was ongoing evolving stroke as a result of this bleed, likely. They sued everybody, and almost everyone settled, except for the emergency physician and the emergency medicine group. They said they did the right thing. The jury, however, disagreed. It found that the primary ED doc, and by extension the group to which the doctor belonged, did in fact negligently and recklessly fail to meet the proper standard of care, leading directly to the patient's life-altering injuries. For this failure, the jury awarded the plaintiffs $13.5 million, well over the state's current inflation-adjusted cap of $400,000. I have no idea why they're able to go over the adjusted cap. I would guess in extreme cases that's what it is, but I honestly have no idea. At the present time, there's no word of an appeal, which I'm sure will happen. What can we take away from this story? First off, this happens all the time. There is going to be many more cases like this throughout the country that never get brought to the light of day. And that's because, one, these vertebral artery strokes take a skilled clinician to diagnose, and a lot of them are missed on CT scan, so that's why the MRI is necessary. And unfortunately, this is related to the medical system itself. The emergency doctors are trying to get the patient stabilized and admitted to the hospital. Whenever they saw that there was no brain bleed on the CT scan, they thought this is potentially just vertigo, and they're not a trained neurologist, they're an emergency doctor. So they said, let's admit it to somebody who knows more about this. Again, a neurologic service or a primary medicine service where they can consider consulting a neurologist if they think that's necessary. The problem is that we have such a shortage of nurses in the hospital that people will sit in these in-between settings for hours or even up to days, where the ED doc thinks, I'm done with this patient, I've already taken care of them, and said they need to go to the hospital, and there hasn't been room in the hospital for them yet, so the accepting team hasn't really taken over care for this patient. It's really unfortunate. It's a system that needs to be worked out better. The nurses in this situation oftentimes are left out of the loop, and they aren't really sure who they should be contacting about the patient. So the communication is the issue. As a result, this patient had a bad outcome. I'm sure this is really frustrating for the patient, the family. They feel like this probably all could have been prevented. Who knows how much of this was because it took so long to get that treatment. I'm sure there was some aspect of it, but it's hard to tell, really. I think for us to learn, this is why we can't avoid, if we go in the hospital, we can't avoid the system the way it is whenever we go into the hospital. And we can't choose exactly who we're going to be working with there and who's going to be taking care of us. But as family members of patients and as patients ourselves, we can advocate for the patient. So if our family member is admitted to the hospital, it is important to advocate for them. The physician and nursing staff that's taking care of them, they don't know what your family member is like on a day-to-day basis. They don't know who they are. They don't understand them the way you understand them. If you think something is wrong, make your opinion heard. And you can let them know that you're not trying to be distrusting of their opinion, and they shouldn't be offended by this, but you should say something is wrong. And I'm sure this family voiced their frustrations. I'm sure there was ways that the communication could have been better from everybody, but you really have to advocate for your family members that are in the hospital. And then if you flip the script, you need to have family members that know to advocate for you if you're ever in a situation where you can't make decisions for yourself. If you can't talk, if you are lethargic, if you are in a situation where you're in a coma, your family members are going to be the ones making the decision for you. And I hope they know that they need to advocate for you to get the proper care. And that starts with noticing that something is off and letting it be known. If any physician or nursing staff gets frustrated at you for that, just know you're doing it for the right reasons and tell them you're doing it for the right reasons. Okay, let's get on to the next story. That's it for that one. It's a large lawsuit, that's for sure. Again, also, let's not sleep on the fact that the guy who wrote this article's name was Wayne Guglielmo. Absolute legendary name. Let's get on to our next article. This is about Bruce Willis. And if you're watching on video, I'm pulling it up now. Bruce Willis has dementia. So, it's not your grandpa's dementia, though, according to Michael Merzenich. He's a PhD researcher, big name in neurology. Let's give a little background on dementia. So, dementia is super common. The most common form is Alzheimer's. There's all different types of things that can cause dementia. The most common is Alzheimer's. Like we said, it's a degenerative form that occurs as we age, but dementia can also occur because we have vascular or blood vessel trouble to our brain. As we get old and our blood vessels wear out, if they're not providing as much oxygen consistently to our brain tissue, our brain will actually shrink, and as a result, our cognition will become worse. There's also dementia when you have a toxic exposure, a traumatic exposure, different diseases. They can all cause different forms of dementia. The most common way we think about dementia is as a decrease in the cognitive function of our brain over time. When people think of dementia, the most common thing they think of is grandma or grandpa is getting more forgetful. Okay, but there's more than that. There are specific types of dementia that have different sort of findings to them and affect different areas of the brain. And one of those is what Bruce Willis was diagnosed with. So Bruce Willis had disclosed his diagnosis of frontotemporal dementia. This literally just means that it is particularly affecting the front area of our brain and the sides near our temples. This guy says he was reminded that all of us are at risk for spending our final epoch lost in a neurologic swamp. FTD is more characterized by the loss of control over emotions and other cognitive functions. It says loss of verbal fluency, which is particularly important to somebody who's an actor like Bruce Willis, is a big part of this, and especially difficult for somebody that's in the business of acting or performing. So the frontal part of our brain is where we get our behavior from. It also controls parts of our speech. The temporal part of our brain, so near the temples, that also contributes to speech. So that's why verbal fluency gets interrupted in this disease. So Bruce Willis, 67 years of age, if the disease follows its typical path, it will probably result in slowly disconnecting and progressively losing emotional judgment, that's from the frontal part, and control, as well as losing a reasonable understanding of what or why any of it is happening. He may also experience a progressive deterioration of the control of bodily functions and general health. Simply taking care of yourself, bowel or bladder control, that can happen as a result of this. This article then goes on to say that most people with dementia lose their cognitive abilities, all of which result in, or different pathways which result in brain shrinkage. Some forms of befuddlement usually result of all of this. Alzheimer's disease is the most common, like we said, but vascular dementias, Parkinson's, Lewy body, Huntington's, all these other diseases, alcohol is especially common, HIV, Lyme disease, and then traumatic encephalopathy. Traumatic encephalopathy can be most notably be remembered as chronic traumatic encephalopathy, which football players have been documented experiencing due to trauma to the head. These are what you might think of as your grandpa's dementia, the types that are associated with old age. Frontotemporal dementia, or FTD, is particularly interesting because it occurs in relatively young individuals. Symptoms usually emerge in the 50s or 60s, and they haven't found why it happens yet. So we just say it's bad luck. There's definitely something that causes it, but we don't know, so we'll just attribute it to bad luck. Second, FTD has little initial impact on a patient's broader memory and associated cognitive abilities. Patients will stumble to come up with the next word and ultimately slow down their speech. They will struggle with translating their feelings and emotions into fast and appropriate actions expressed in their mind and their physical body, while their memory will appear intact. Another thing that he notes here is a lack of that type of self-awareness is an expected consequence of FTD. I've taken care of several patients with this, particularly in rehab hospitals where we're trying to get them home. We try to get them as functional as possible on their own, but a lot of what we do is training family members. For these patients, you have to be patient with them because they don't have an awareness as to what's going on and what the consequences are for those around them. They also lose their social skills, so they don't understand when they are being offensive to people, when they're doing inappropriate things in public. So to take care of somebody with FTD, especially as a family member, it takes a lot of patience. Then it gets more into the scientific aspects of why we think it happens. So patients with FTD experience an initial loss of a special population of cortical neurons located within the salience network. That salience network is designed to quickly read and evaluate our complex thoughts and emotions, and via those economoneurons, initiate appropriate neurologic and physical responses. When we see or hear or otherwise sense something that induces fear, alarm, or a potential reward, the salience network in our brain acts as a kind of gatekeeper. It controls our response. In life, controlling our response is so important, especially considering the fact that we're social beings. When people don't have this control, it's extremely off-putting to other people, and it makes it really hard to do day-to-day tasks that involve other people. Controlled emotional response is at the heart of our humanity, it said, and it's a sad day when we lose it. When we scroll down here at the end, it says, alas, like so many things in medicine, there is promise, but at this moment, for this famous patient, our current medical science appears to be a day late and $1 short. So this is sad for Bruce Willis. This Michael Marcinich guy, just reading down here in the description, he is often credited with discovering lifelong plasticity, being the first to harness plasticity for human benefit in his co-invention of the cochlear implant. That's a fun fact. So what's the takeaway that we have from this article? First, brain disease is complex. The problem with brain disease is we don't truly understand how cognition works in the brain. So we kind of understand the brain, and we're trying to take something that we kind of understand and develop treatments for it, which makes it really difficult. The other thing that we can take away from this article is that there is such a thing as bad luck. People will be going through their life. They can be the best people in the entire world, and sometimes they'll get a disease that is completely incurable. And that's just the way life goes. It sucks. And it's unfortunate, but there really is such a thing as bad luck. With Bruce Willis, that seems to be the case. Going back to our last article, though, we talked about how it's important to have people in your life that will help you make decisions whenever you can't make decisions for yourself. That's one of the things that I'm sure Bruce Willis and the people around him have talked about. Because in frontotemporal dementia, eventually you will get to the point where you don't have insight into what is going on in your condition. If you're ever diagnosed with one of these diseases, it's important to have had these conversations with your family members and those around you, because ultimately when you can't take care of yourself anymore and you can't make decisions, they're going to make decisions for you. So have conversations about this. Discuss this with your friends, your family, whoever is going to be closest to you throughout your life. Make sure they know what you want. It's weird, and it's something that you don't want to have to rely on. But trust me, as someone who deals with people after catastrophic brain injuries, after catastrophic traumas, family and community are so important. And if you know if they know what you want ahead of time, it will make it so much easier for you, but it'll also make it easier for the people around you in case something like this happens. So that's it. That's all I have for the podcast today. These are two very interesting stories. I just want to say thank you for stopping by. Thanks for listening. This is the third episode of the podcast, and at early stages like this, I really appreciate any feedback that you can give me. And I'm doing this for you. I want this to be something that we can build together. We can have conversations. I don't want this to be a one-way street. So let me know what you think. You can comment if you're listening on Apple, Spotify, YouTube. Leave a review. Give me a like. Leave a comment, whatever you can do. This is The Prescription Press. I'm your host, Nolan Fisher. Have a great day.